So for Irene's face today, we're going to do one of our absolute classic treatments, which is the cheek filler. And quite often when people come to aesthetics for the first time, this is the first area that we start treating, is the cheek. And the reason for that is that it really is the foundation for the rest of the face. It's one of the most prominent parts of the face that loses volume throughout the aging process. And when you correct the loss of volume in the cheeks, as well as taking away some of these indentations, it has a few other benefits as well, in that when we expand this cheek, it gives us a little bit of lift to the lower section here, and it also provides a little bit more support to the lower eyelid. So we usually see after correcting the cheek that we get a little bit of lift here and an improvement in the lower eyelid as well. So that's why we quite often do this as the first step. So for Irene's face, we're going to start off with some width to the cheek over here. And the reason that I want to do that is that right now she's got quite a square shape to her face, whereas a female face should ideally be broadest at the cheekbone. It's a nice sort of flattering feminine shape. So we want a little bit more width here. And then we want to place a wee bit of volume into the fat in the lateral cheek. Okay, and that helps to give us a little bit of lift. And then in the medial cheek, you can probably see easier than this side, there is some volume loss and hollowing in what we call the deep medial cheek fat, which is in here. So we're going to have a little bit of width up here, a wee bit in the lateral cheek, some in the deep medial cheek, and then we might come right up into the mid-face. We'll see how it all looks after I've done that, and then we can decide if we also need a bit further into the mid-face. I'm going to use a total of 4 cc's today, so that might sound like quite a lot, but actually it's less than a teaspoon, which is 5 mils. We're using 4 mils, and we're using it over this huge big area here. So actually, when you think about it, it's really quite a small amount, and it's quite impressive that you can achieve so much with so little. Cool. Have a wee lie back. This usually feels odd, in that you can feel the sensation of the movement under the skin, but it shouldn't be painful. So right now I've added 1 mil of filler to the lateral part of the cheek over here, and we can see that this side of the face is just starting to look a little bit more lifted than that side. So that's what we can achieve on one side with 1 mil. We can see that we've still got some hollowing in here. So I'm going to come back in with another mil and fill into that mid-face so that we get a nice complete rejuvenation on that side. All right, have a wee lie back. So I'm just assessing how this looks with each different compartment that I fill. I'm checking to see what the impact of it is. I'm having a look to make sure that it's achieving what I'm expecting it to achieve before I move on to the next part. And it really is just a case of fine-tuning the treatment to the individual. Although there may be similar themes between what we do with every person, we usually start with the cheek and then move to the chin, for example. The way that things are done for each person is really customized and tailored to that individual, and what works for one person won't necessarily work for another person. So it's important to just keep reassessing and checking and making sure that we're getting what we're thinking. We've now filled this cheek, but not this side, and you can see on this side that the cheek area looks a little bit lifted. The jowl here looks less on this side compared with that side. And the bag under the eye, even though I haven't done anything to the under eye area, has already started to look less tired than that side. And then give me a wee smile. So when she smiles, even this side of the face looks higher. All right. And that is literally, we've achieved all of that just from putting 2 mils of filler in one cheek. And now we just need to do the same on the other side to get our balance back up. And you can see that we're doing all of this on both sides through just one tiny little needle puncture with virtually no bleeding. And slightly, fabulous. Give me a wee smile. On both sides, the cheeks lifted nicely. It's helped us to reduce the jowls slightly. And it's also helped us to reduce the appearance of the bags. Now, this is quite often the first stage that we do when people are starting with aesthetics. The next thing that we could move on and do would be to use some filler along the chin to improve the jowls further. Under the eyes to blend the bags in a bit more. We could probably do some along the jawline as well. And maybe a little around the mouth. But for a starting position, filling the cheek is a really good place to begin.
But that will be fillers as well?
Yeah. Yeah. But from a starting position, using filler in the cheeks is a really good place to begin because it just helps to give the face a nice overall rejuvenation, and it gives us a really good foundation to build on when we move forward.
Wow. That's so good, isn't it?
It's fabulous.
It really is. That's amazing.
Instant facelift
That really is.
in 10 minutes.